Good day everyone. So today we will be assessing the hair, skull, face, and nails. So first, this procedure involves a thorough and careful observation of the client's hair, skull, face, and nails in terms of texture, thickness, shape, symmetry, and general appearance and condition of the client. So first we have the objective to observe and describe the general appearance of the patient's hair, skull, face, and nails. Second, to identify and assess any local or symmetric health condition of these organs. 3. To document overall assessment of the different findings of the client. So we have the safety and security measures, proper hand hygiene, use proper tools or equipment, and 3. Wear proper or appropriate clothing. So pre-procedure preparations, wash hands, introduce yourself to the client and identify the client's identity and explain what you are going to do and why it is necessary and how can client cooperate. Number 3, gather all the necessary equipments. And number 4, provide privacy. So first we have the gloves. And the gloves, we have the tape measure and the comb. So first is we introduce ourselves to the client. So good morning, ma'am. My name is Vic Anthony Alas, and I will be your student nurse for today's shift. So, may I know your name, ma'am?
Laser Excel, sir.
Ma'am Louisa, today I will be assessing your face, skull, nails, and hair. So, just follow my instruction, ma'am, and I will just ask you a question and guide you throughout the procedure.
Yes, sir.
So, next is we put the gloves. Prevent infection spread. So we wear gloves after washing the hands. So procedure. First step, inquire if the client has any history of the following: recent use of hair dyes, rinse or curling or strengthening preparation, recent chemotherapy, presence of disease, lumps or bumps, itching, scaling or dandruff, loss of consciousness, dizziness, seizure, headache, facial pain or injury. Step number 2, if so, ascertain the following: when and how the lumps occurred, length of time if any known cause of the problem, associated symptoms, treatment and recureness, diabetes mellitus, peripheral circulatory disease, and lastly, previous injury or severe illness. So, good morning, ma'am. So, today, mag-start pa naman mag-pro... Na ko yung mga question karon ma'am, para ma-assess na kung imong buhok na dayon. So, ma'am, kanang gagamit ba ka ng mga products pang pa-color, pang-pa-strengthen, pang-pa-straight sa buhok, mga hair products, ma'am?
Yes, sir.
And kanang ka-experience ba ka ma'am kanang katul kay imong buhok usahay, then kanang grabe mong kaspa,
Wala, sir.
then kakabantay mo ka ma'am kanang kakalipong ka, kanang kakawala imong consciousness, or ga headache ka, may sakit sa imong ulo. And last question na Miss Gapa chemotherapy mo ma'am?
Wala, sir.
Okay ma'am, so the client don't have any abnormalities, and proceed to the next procedure. Assessment of hair and scalp. Step number 3, inspect the evenness of hair distribution. Step number 4, inspect the hair thickness or thinness. Step number 5, note presence of infection or infestation by parting the hair in several areas and checking behind the ears and along the hairline at the neck. Step number 6, inspect the amount of body hair, puberty marks, onset on the pubic hair, growth with increased hair growth on legs and axilla. Step number 7, palpate the scalp for tenderness and masses. Step number 8, palpate the hair texture. So, good morning ma'am. So karon mag-assess na ako sa imong buhok ma'am. Okay ra ba nga hikapon ako yung buhok ma'am?
Yes, sir.
Okay, thank you ma'am. So, good ako ma'am. So for this procedure, we will use the comb. So, inspect the texture or the thickness of the hair or the thinness. And inspect for infection or infestation behind the ears and the neck. So karon mag-inspect ko sa imong kuan ma'am ha, body hairs. So inspect ko lang kuan din ha. Alag lang ako elevate sa imong kuan. Ma'am, palihog lang ako sa ba, ma'am, if sakit siya, ma'am. Kaya sakit, ma'am? Kana, ma'am. Next is palpate the hair texture. So I detect no abnormalities and there are no infestation or infection, and the client didn't respond when I palpate the scalp, so which means it doesn't have any abnormalities. So proceed to the next procedure. Inspect the skull for size, shape, and symmetry. Assess frontal measured head circumference in the newborn. Step number 10, palpate the skull for nodule or masses and depression. Use gentle rotating motion with fingertips. Begin from the front and palpate down to the middle line and palpate each side of the head. Note masses, tenderness, and scalp motility. Inspect the facial features. Inspect the eye for edema and hollowness. Step number 15, note symmetry of the facial movement. Step number 16, ask the client to elevate the eyebrows, frown and lower the eyebrows, close the eyes tightly, puff the cheek, and smile and show teeth. Step number 17, palpate bony structure of the face and note condition and symmetry of tenderness and muscle, tone and TMG function. Palpate the skull for size, shape, and symmetry. Palpate the skull module masses and depression. Use gentle rotating motion with fingertips. Begin from the front and palpate down the middle line. Then palpate each the side of the head and inspect the facial feature. So mag-assess na ako karon sa imong face sa imong skull ma. So pagsabalan na ako ma'am if naay ka ng mga nakay mabatian ng sakit or discomfort ma'am. So magsugod na ako ma'am. Kaya sakit ma'am? Kani ma'am. And parang straight lang concept ka na ma'am. And the client didn't react to our palpation, which means there are no abnormalities, and I don't see any edema or hollowness in the client's eye. So let's proceed on assessing the face. So ma'am, paliw kung taas na yung eyebrow ma'am. Dayon frown line ma'am or mugot. ubos sa imong eyebrow dayon, ma'am. Then i-close imong eyes tightly and puff your cheeks and smile with the teeth. Okay, very good. And next step is, so I detect no abnormalities. The facial muscle is okay. So let's move to the bony structure. Ang palihog sa bago, ma'am, if makadetect yung sakit, ma'am, ha? Ano yun, ma'am? Okay, wala. And palihog close open sa imong jaw. 3, 4, 5. Okay, very good. So I detect no abnormalities and the client didn't react to the palpation and the jaw muscle is okay. So let's proceed to the palpation of the skull. Wait, ma'am. So the client didn't react to our palpation, which means overall the skull and face features are okay and there are no abnormalities. So proceed to the next procedure. Assessment of the nails. Inspect the fingernails, palpate shape to determine its curvature and angle. Inspect the fingernail and toenail bed color. Inspect the focal and generalized abnormalities such as ridges and clubbing. Inspect the tissue surrounding the nails. Palpate the fingernails and toenail texture. Perform blanch test of capillary refill. Perform 2 or more nail between your thumb and index finger. Look for blanching and return of pink color to nail bed. Last is document the finding in the client's record. So, karon ma'am is mag-assess na ako sa imong nails. So, palihog lang ko ganang yung nails, ma'am. And sa imong toenail pa din, ma'am. Pasaba, ma'am, if na kayo ma-detect na sakit, ma'am, ha? Yes, ma'am. I'm kuan, ma'am. Kanang sakit, ma'am? So the client didn't react to our palpation, which means there are no abnormalities or any pain, and I detect no and I didn't see any infection or something, and proceed to the blanch test. So ma'am, palihog ana sa imong thumbs, ma'am. Okay, very good. Okay, very good. Okay. So the client's nail bed returned to its pink color, which is normal within 3 seconds, and the client didn't react to our palpation, so which means there are no abnormalities, and overall the nails are good. Thank you.